The heart is hollow, vaguely cone-shaped, and weighs only about 250 to 350 grams, a pretty modest size for your body's greatest workhorse. And although Americans tend to put their right hand over their left breast while pledging allegiance, the heart is actually situated pretty much in the center of your chest, snuggled in the mediastinum cavity between your lungs. It sits at an angle, though, with one end pointing inferiorly toward the left hip and the other toward the right shoulder, so most of its mass rests just a little bit left of the mid-sternal line. The heart is nestled in a double-walled sac called the pericardium. The tough outer layer, or fibrous pericardium, is made of dense connective tissue and helps protect the heart while anchoring it to some of the surrounding structures, so it doesn't like bounce all over the place while it's beating. Meanwhile, the inner serous pericardium consists of an inner visceral layer, or epicardium, which is actually part of the heart wall, and an outer parietal layer. The wall of the heart itself is made of yet more layers, 3 of them. That epicardium on the outside, the myocardium in the middle, which is mainly composed of cardiac muscle tissue that does all the work of contracting, and the innermost endocardium, a thin white layer of squamous epithelial tissue. Deeper inside, the heart has a whole lot of moving pieces that I'm not going to pick apart here, because the really big thing to understand is how the general system of chambers and valves and veins and arteries all work together to circulate blood around your body. Of course, fluid likes to move from areas of high pressure to areas of low pressure, and the heart creates those pressures. Form, once again following function. Your heart is divided laterally into 2 sides by a thin inner partition called the septum. This division creates 4 chambers, 2 superior atria, which are the low pressure areas, and 2 inferior ventricles that produce the high pressures. Each chamber has a corresponding valve, which acts like a bouncer at a club at closing time, like he'll let you out, but not back in. When a valve opens, blood flows in one direction into the next chamber, and when it closes, that's it. No blood can just flow back into the chamber it just left.